Good afternoon, everybody. Thank you for joining us this afternoon on a wonderful Friday here on the East Coast at 3 o'clock and 12 noon on the West Coast. My name is Amy Helayel. I'm the Global Education Manager for Zest Dental Solution. And again, we'd like to thank everybody for tuning in for another edition of our 15-minute Locator Lunch. Everything Locator and Danville and all of our products. And today I am very, very honored to have a wonderful guest with me today. We have Behnoosh Bayati. She is our Global Product Manager, and she's going to be talking to us about some exciting products that we have here at Zest. So Behnoosh, thank you so much for making some time out of your day to spend it with me and in our audience. So I would like you just to take a few minutes and introduce yourself.
Yeah, of course. Thank you so much for having me. Hi, everyone. I'm Behnoosh Bayati. I am so excited to be here with you today. I am the Danville Materials Product Manager here at Zest Dental Solutions.
Can you tell us a little bit about what Danville is? I know we're all familiar with locators and what our locator and everything. So what is our Danville line here at Zest?
So Danville Materials is basically our line of dental materials. We call our line of dental materials and our line of titanium side. So titanium is everything about locator, and material side is all the materials that you use at a day-to-day dentistry. And that falls under my part of the job.
So clearly where all the cool kids work is at the Danville side of Zest. So, and again, can you just tell us a little bit about what you do for us at Zest Zest and Danville as the Global Product Manager?
Yeah, sure. So as a product manager, I get to wear multiple hats every day, from strategy, creativity, communication, and anything in between. I focus on turning customer needs into valuable products, and I work closely with different departments, our R&D, our engineering, marketing and sales, and many others. We want to make sure we are building the right products for our customers and that we are bringing them to market in the most effective way.
That's awesome. So what did you bring with us today, or what are you going to talk to us today about?
So I thought it's a good idea to talk about Riga Protect. It's one of my favorite products out of the Danville Materials portfolio.
But it sounds very, very royal with the name. So
yeah,
tell us a little bit about it. It seems very important. So I'm excited.
Yes, it is. It's a very important product. It's a little product that no one thinks it does great, huge things for a patient and a clinician at the same time. It's a silicone polymer that is a protective coating for denture and fixed prostheses. It can be applied chairside by the clinician or in the lab during fabrication. I like to think of it as an invisible superhero cape for prostheses. It's almost invisible to the naked eye, but it has powerful benefits for both patients and the clinicians at the same time. How does it work? It actually creates a slippery surface that prevents plaque and bacteria from adhering to dentures, to fixed prostheses, or even natural teeth. It has a very simple application process. It is self-bonding, and once it's applied, it provides protection up to a year. And then at regular hygiene appointments, it could get reapplied to the prostheses again.
So I just saw a picture of the applicator on the screen right there, Behnoosh. Is it challenging or is it difficult to apply, or what's the user?
Actually, it has a surprisingly simple application process. All they need to do is just to take 3 simple steps. They need to remember, it's very important and crucial. The vial is not empty. Even if it looks empty at first glance, it's not. All they need has been already applied to the applicator tip, so it's preloaded. There is no extra product in the vial. The vial is only a protector. They take the applicator out, they brush the material evenly over the prostheses, and then they use a piece of gauze to spread and thin the material evenly over the surface. And this step is really crucial. They want to make sure that they don't skip it. It's actually make sure by this step, they make sure that they are there is optimal bonding of the product. This product is self-bonding, no drying is needed, no light curing is needed. It's tasteless, it's odorless, it's clear. And when they are done with this step, what's left behind is an invisible layer, just 1 micron thickness. And that's enough to provide up to a year of protection. They just need to trust the process. They need to follow the steps and then just let Regal Protect do the magic.
And we had a viewer that typed in a question that you already answered. So again, just to clarify, does this require a light cure or is it self-cure? So just to reiterate that.
Self-bonding, no light curing is needed. As soon as they are done with the final step, wiping it with a gauze, they can place the prosthesis in patient's mouth.
So again, why would a clinician choose to put this on a prosthesis, once a year, as you said? And if it is once a year, is there any benefit of adding it more than once a year if a patient comes in, let's just say every 3-6 months for a hygiene visit?
No, it's not needed to be reapplied unless there is major adjustment to the prosthesis. Like if they polish it or they do something like a major adjustment to the prosthesis, they need to reapply it. But the way that it works, that a slippery surface that Regal Protect creates, it actually, as I mentioned, doesn't let any bacteria build up to the body of the prosthesis. It significantly improves hygiene efficiency and makes it much easier for patients to keep up with their prosthesis regular hygiene. Think about all of those hard-to-reach areas that are under a fixed prosthesis especially. Regal Protect helps to minimize plaque and debris buildup in those spots, and that drastically reduces any maintenance challenge for the patient. If this surface is slippery and nothing really stick to it, it means when they are using their water pick, it's much easier for them to clean that area. And what's the result for the patient? Fewer oral health issues. The patient is going to be happier with the outcome of the decision that they have made to probably move to a fixed prosthesis, and also improved overall well-being of the patient. Imagine that there is no buildup of bacteria 24/7 sitting in their mouth. Now they are able to clean it up because that slippery surface doesn't let anything really stick to the prosthesis. But as I mentioned, it's not just the patient who is benefiting from the product. It also offers significant advantages for the clinicians. They experience fewer complications for their patient. They will have a lower rate of implant failure in their patients. Also, it's really important, it's the added bonus, as I call it, it saves so much chair time during their hygiene checkups. As you know, normally every time they have one of these prostheses, especially the fixed prosthesis, doing their regular hygiene, they need to place it in an ultrasonic cleaner for anything between 15 to 30 minutes. It depends on how much buildup is present on that prosthesis. But when Regal Protect has been applied at the time of insertion, all it takes is 30 seconds under running water and a toothbrush. And that's a huge time saver for any busy practice.
Man, I wish I had that as a hygienist. I don't know how many minutes I've spent scaling off, plaque and calculus off of prostheses. So
yeah, it's gonna change the life of hygienists drastically, because not only that, but also Regal Protect, because it doesn't let any bacteria sit on the body of the prosthesis, it's going to reduce odor drastically. So the benefit for the patient, they're not going to be so self-cautious about people every time that they want to be, in social interactions, talking with people, covering their mouths, because there is no bacteria sitting there, or it's very minimal. And also for the hygienists and clinicians, when they're doing the cleaning, the experience is going to be more positive for both ends, the patient and the clinician.
Absolutely. Behnoosh, a couple questions coming in. One is, let's see, is this a product that is sold in bulk or per patient?
It comes actually in a 5-pack, and each pack has 5 vials that has enough material for 2 full arches. So it's a single-use product. When they are using it on the patient, especially chair side, they want to make sure, because of the cross-contamination, they're not using it on different cases. If they're using it in a lab setting and the prosthesis is brand new, it actually has enough material to go over 3 full arches. And the reason is we wanted to make sure we have room for one, error, just in case if they need to do adjustment or anything, they can reapply it.
Is there an expiration date on this, Behnoosh?
No, it has no expiration date.
Oh, that's even better.
Yeah.
That's even better.
It's an oil-based product, so it's going to stay put, and there is no chance of evaporating or anything, as long as they are trusting the process, they are following the IFU, they're going to see a significant result of this product.
does this change or affect the occlusion at all? You did mention about how thin this Regal Protect is, but
no, it's not going to affect at all. All they need is just 1 micron thickness of this product, and that's all that is needed to have this optimal results. So no changes at all.
Behnoosh, can you talk about, we talked about locator fixed at one of our locator lunches, and we talked about different material options for fixed prostheses, but we, highlighted overdentures as well. Can you talk about what type of material Regal Protect can go on as far as dental material? We talk about acrylic, there's zirconia, metal, is Regal Protect applicable for different materials?
So Regal Protect is compatible with acrylic, with metal, PMMA, zirconia, and also a combination of these materials, whether they are digitally or analog produced.
Can you put Regal Protect on implants? Sometimes there are implants that are exposed, the threads are exposed. And
Yes.
A big issue is implant failure because of those exposed threads. Can Regal Protect go onto implants themselves? And is there any damage to any soft tissues?
It could go on implants and no damages on the soft tissue.
Well, this is just like a miracle product. I don't know why not everybody is doing Regal Protect in all of their offices.
I know. Actually, it's funny. Every time that I talk with one of the clinicians about this product, they get surprised and they say, "I was looking for this product all my life, and I didn't know that it exists." I'm like, "Well,
this
you have
is
it
a
now.
great
You know about it."
And a lot of our listeners and followers, we are a very scientifically based company. One of them is studies. And are there any studies out there, like scientific studies, that talk about the benefits of this, this product, and then on the prostheses and success?
Yes. So 2 prestigious institutions, Harvard University and Tufts University, they both conducted studies on Regal Protect, and these studies confirm our claims about products' effectiveness, compatibility, and all the long-term benefits. And we can confidently claim that Regal Protect reduces microbiota colonization, it prevents dental disease, it decreases plaque formation, it even soothes irritated gums, it reduces bacteria adhesion on the teeth and the prostheses, and many other benefits that we can claim based on these 2 studies that we have on hand.
And again, just to answer my question that I've asked earlier, if it's able to be used on dentures and prostheses, single tooth implant crowns as well, bridges,
Yes.
and other type of appliances, retainers, things like that?
Exactly. As I mentioned, it's compatible with a variety of materials, acrylic, metal, PMMA, zirconia, a combination of these. So it could be used on a variety of dental appliances. Even you can use it on your night guard if you want to.
So, I joked in the beginning about the name being very royal, but after you've explained all this, I can see why it's named Regal Protect. It's a phenomenal product.
It is. It's a really great product. It's a game changer for the patient and for the clinician at the same time. I always like to say that if your patients don't talk about their everyday challenges with their fixed prostheses, if they don't talk about their hygiene problems, if they don't talk about how self-cautious they might be about the odor that they sense from time to time, it doesn't mean that problem doesn't exist. And as like many clinicians that they don't know about this product, a lot of patients don't know they have this option.
Right.
But if they try it, if they use it and they see the long-term benefit, they're going to love this product.
And Behnoosh, with our last minute, this is a phenomenal locator lunch, and I just thank you for bringing this to our audience.
Oh.
So last question before, how does our audience go about getting this into their offices? What's the cost, and how do our listeners and our viewers get this started today in their offices?
Yeah, so they can directly order it from our website. And for this special launch today, I actually put together a promo code that they can use and get 20% off a 5-pack.
That's awesome. That's awesome. Yeah, thank you.
And, just to start using this product, this is great. It's going to be a game changer for their offices, saving chair time at the hygiene appointments, fewer complications for the patient. And I think at the end of the day, it's going to benefit both end of the, involved in the fixed case, the patient and the clinician at the same time.
Well, Behnoosh, I can't thank you enough for spending 15 minutes with us today. This is an amazing product. This is a great opportunity to, impart a lot more knowledge out there to our viewers. So I want to thank all of our viewers for coming out and spending some time with us, spending your lives with us. If any questions on Legal Protect or want to take advantage of this amazing 20% off, please visit our website at zestent.com. Again, you can order from there, and you can place your orders in there. Like I said, please take advantage of this discount code. I thank you so much, Behnoosh, for spending some time with us, and to our audience.
Thank you so much for having me.
And we look forward to seeing you guys again in a couple of weeks at a next Locator Lunch. Thank you so much.
Thank you. Have a good day.
Thank you, Behnoosh. You too.